Hello, I welcome you all in today's session. We are celebrating Women's Day this year by spreading awareness about cancer detection and care. The theme of this program is Yes, I can detect cancer early. Yes, I can survive cancer. In this series of events, we are talking various field experts about early cancer detection and care for women. Cancer is a disease that has potential to debilitate the life of a person physically, emotionally, and economically in a manner other ailments can. Women are custodians of our family health, playing a critical role in maintaining the health and well-being of our communities. In other words, healthy women will ensure healthy families, healthy communities, and a healthy nation. Hello, I welcome you all in today's session. We are talking to Dr. Anuradha Chougule, who is professor and faculty scientist and consultant at Tata Memorial Hospital, Mumbai. Welcome, Dr. Chougule, for being part of this program today.
Thank you, Dr. Ashutosh.
So my first question is, cancer is considered a genetic disease, and what does it mean for the general population, and also if cancer is inherited?
Yes, somewhat cancer is a genetic disease. Either it can be a somatic or it can be inherited disease. When I say somatic, that means I say there are some sporadic changes because of the environment, which causes the genetic change or change in the sequence, which causes the cancer, and it can be as an inherited one, because you can see that both the genes, inherited genes, come from the parents, and in this most of the BRCA gene are also carried to the progeny. But as I said, the BRCA genes can be a normal one as well. But if you find there is a genetic change or mutation in that inherited BRCA gene sequencing, then we call it as an inherited cancer disease. Or for that matter, in terms of breast cancer, it can be a breast cancer disease.
Okay. So is inherited genetic testing is for all the women, or how does a woman decide on to go for screening for?
Yeah. So as I said, I mentioned over here that about 5 to 10% breast cancer only comes as a hereditary, meaning that they result directly from the gene changes which are passed on from a parent. So if 2 or more first degree relatives with like mother, sister and daughter with breast cancer are diagnosed at an early age, then we say that this is an inherited cancer gene. So everyone has 2 copies of BRCA1, BRCA2, but however, as I mentioned earlier, if there is a change in the gene sequence, then we call it as an inherited. So it can help if they have a hereditary inherited gene change, and this change can make them such more likely to get a breast cancer or ovarian cancer in the woman. So yeah.
So, ma'am, you mentioned about BRCA genes in respect to breast cancer. So, does BRCA gene is found in everyone's body?
Yeah, BRCA gene is present in everyone, but it can be a normal sequence. But if at all there is a change in the sequence which has got inherited from the parent, then we say that there is an inherited breast cancer and not a somatic breast cancer.
Okay. So,
but for that matter, we need to, if the patient has a tumor, then we need to do the somatic BRCA testing, and then we need to look for, if the BRCA1 is present, then we need to look for the inherited blood test, so to identify whether it is a germ-line mutation.
Okay, so somatic testing should be considered as a first line test to detect breast cancer, right?
Yes, somatic mutation should be considered as a first line testing, and then we should go for the germ-line testing. But if there is a strong family history, like mother or grandmother or so, then we should also at the same time we should look for the germ-line testing as well.
Thanks. So this brings me to the final question of my today's session. So what will be your message to women regarding cancer care, especially on this Women's Day?
Yeah. It will be my strong advice for the women who are very busy in their day-to-day activity, that they should spend at least 5 to 10 minutes for their own self-assessment. Like, as I can say, we should observe the things like a lump in or near your breast or under your arm, changes in the size or shape of your breast, dimpling, puckering, or bulging of the skin, a nipple that has changed position or an inverted nipple. There can be a skin redness or soreness or rash and the swelling. So, or also we can observe that if there is a nipple discharge, which could be watery, milky, or yellow fluid or blood. So, or the recent, I think, reddishness should be also point to be taken into consideration.
Okay. Thank you, Dr. Chougule, for being part of today's session. Thank you very much for joining us.
Thank you so much.
Thank you.